When a patient comes into behavioral health, each and every time we ask them to complete a simple questionnaire that helps us to get a good idea of their distress level. Distress can be caused by anxiety, life circumstances, depression, pain. All sorts of different reasons cause distress for our patients. After we figure out where they are as far as stress level, if we come to a point and decide that it's beginning to impair their day-to-day function, whether that's at home or at work or at school, we sit down as a partnership, the patient and I, and start talking about specifics. So some of the treatment options for patients that come in and are under a great deal of distress are very practical. What we do is, first of all, begin with ways of improving their baseline resiliency, their ability to tolerate frustration, stress, and that can include things as basic as their exercise routine. Are they getting enough sleep? Is it quality sleep? And what about incorporating some recreation into their weekly routine? We look at their health care conditions and if any of those are impacting their day-to-day function. And I work collaboratively with the patient and the physician in improving whatever it is we may identify. So what we may begin with is practicing identifying the person's own warning signs or signals. So these include things that the person may tend to think, feel, or do when they're first experiencing stress. And we learn the difference between mild, moderate, and severe amounts of stress because just like coping with pain, when we're coping with stress or anxiety, we may want to use different strategies for different levels of stress. That is our next step, and we identify things that fit each person that comes in that they can do for mild amounts of stress, moderate amounts of stress, as well as severe stress. My goal is to empower patients to feel better quickly. So I do tailor-make each and every patient's care plan and design it so that they will find it useful, practical, and effective.